Welcome back. Winter has only just started, but there is already a flu epidemic here in the U.S. The Centers for Disease Control now say the flu is so widespread it is in 36 states and is responsible for the deaths of 15 children across 9 of those states, making matters potentially worse. Officials say the flu vaccine millions of us got this year is not a good match for this year's strain of the flu. I want to bring in Dr. Jennifer Caudill with Rowan University for more, a family physician. You know, here are the 2 questions everyone's asking me. Number 1, if I got a flu shot, will it work? Number 2, if I didn't get a flu shot, should I? Answer those for me.
Those are great questions. So first of all, we do know that there is a mismatch this year between the current flu vaccine that we have and the predominant strain that we're seeing out in the community. So that does mean that the flu vaccine might be less effective on that particular strain, but it is very likely that the flu vaccine will give some protection, and this is very important. So in answer to your first question, people still should get some protection. And remember, some protection is better than none. So that's really important. I think the answer to the second question is if you haven't gotten your flu vaccine, because of the answer to the first question, I would say absolutely go out and get it. Because again, some protection is certainly better than none.
Yeah, still get the flu vaccine. In many public schools, you're not going to be able to start in the spring after Christmas and the holidays if you don't have those flu shots and the paperwork for it. So let me ask you this. We can show a map of where it is most prevalent. You can see in the southeast where it's a little bit warmer. It seems to be most prevalent. They're calling this an epidemic. Why are we seeing it more in these states, do you think?
Well, you know, we are seeing it. The flu activity right now is quite widespread. There are a number of states that are experiencing activity. I think there's a number of variables that are playing a role into that. First of all is this mismatch that we've been talking about. Okay, that's certainly playing a role into what we're seeing. But the other thing is that, you know, the predominant strain that we're seeing out in the community right now is the influenza A H3N2 virus, strain rather of the influenza virus. We know that this particular strain tends to cause more severe illness, can cause higher rates of deaths and hospitalizations compared to other flu strains. But this, as well as other variables, I do think is playing a role. So, you know, I think what we also need to keep in mind is that the flu season, we're still smack dab in the middle of it.
Yeah.
The flu season technically can go as late as May. So we still have a lot of time really to see what's going to happen and how the trends work.
There's some really, I mean, a lot of people talking about the flu shot, the flu vaccine, a lot of people debating whether they should get the flu shot, or some people angry that maybe they think it's not going to work for them. But the most important thing here is to wash your hands, to stay home if you're sick, to stay away from other people who are sick. Give us some of that common sense advice that you can do. You can't control the flu vaccine, but you can control some other things.
That's absolutely right. And you know, you mentioned some of the most important ones. Hand washing, by far, number 1, is one of the best things that we can do to prevent illness. Washing your hands with soap and water. Now, if you don't have soap and water, just get a good alcohol-based hand sanitizer. That should work as well. Make sure that if you're sick, that you're staying home. Don't go to work. Don't go to school and spread it around. And also other simple things. You know, if you're coughing or sneezing, rather than coughing or sneezing into your hand and then, say, touching a doorknob, which could cause you to transmit virus or bacteria, make sure that you're coughing or sneezing into a tissue or into your elbow. You know, prevention is very, very important. And I'd also say that the other thing that's important is if you do experience flu symptoms, you know, it's not that we can't do anything about it if you come down with the flu. We do have antivirals, and if taken within roughly 2 days of symptoms, they can be very helpful. So you want to call your doctor if that happens.
Quick question, doctor. Do you think the science is keeping up with how quickly the virus seems to be changing? And I mean, who's winning, the science or the viruses?
Well, you know, I'll tell you, every year sometimes it's a little bit different. As scientists, they make their best guess for figuring out which strains are going to be predominant for the next season. And there's a lot of science and math and brains that go behind trying to make that prediction. But the truth of the matter is that sometimes we get it right and sometimes it's off a little bit. That's why all this prevention is very helpful too. And still, yes, get the flu shot. That's very important.
All right, Dr. Jennifer Caudill, thank you for that great advice. Wash your hands and still get the flu shot. All right.